Hello everyone, welcome to Tech Sharmit. In this session, we are going to discuss about another medical terminology that denotes the numbers or amount. Okay, so this is the second part for that thing. And in previous session also we covered few terminology and few prefixes mainly that denote something as a amount or numbers. Okay, so whenever there is a need to show some number, amount, quantity, then in that case we will use these prefixes. Okay, so as this is a vast topic, so I have divided the entire session into some parts where we will discuss. Firstly, we will discuss about the prefixes, then suffix, root word, and connection word. That in that way we will proceed. Okay, so let's see what all terms we have today. So the first prefix is pen or omni. Okay, so these both prefixes are used to show something relevant to all or involving of all. So whenever there is a sense to add something as to represent the all term, then in that case we will use pen or omni. Both are used. Okay, so let's see the examples now. The first example is pancytopenia. So what is written here? A condition where all types of blood cells. So you can see here we are denoting all types of blood cell. So all is represented by pen. So pen is indicating that all cytopenia where all types of blood cell, red blood cell, white blood cell and platelets are decreased. Okay, so whenever there is a whenever you want to show something as all or involving of all, then in that case we will use the prefix pen. Okay, then we have pancreatitis, inflammation of pancreas which can cause abdominal pain, nausea and vomiting. So here again pen is used in order to show the involvement of everything, inflammation of the pancreas, entire pancreas. Okay, so that's why we are using the prefix as pen. Then we have panophobia, an excessive and irrational fear of everything or a wide range of situations. So you can say it is a psychological disorder where excessive and irrational fear of everything. In this case, patient is facing the issue that he is facing the fear of everything. Okay, so in that case we will use pen as a prefix, panophobia. Then we have penencilophthalmos, inflammation of the entire brain. So again you can see there is a sense of involving of everything. So inflammation of the entire brain, the complete brain, all part of the brain. Okay, usually caused by viral infection. So again we are using this term pen as a prefix that is used in order to showcase the involvement of everything. So such words like entire and everything, all, so these all senses are presented or denoted with the help of prefix pen. Same thing you can also denote with the help of omni. There are some terminologies where you can use omni as well. Okay, but pen is most frequently used thing, so that's why I have noted down the examples for that only. Okay, but in some cases you might see few terminologies where omni is used. So omni is also used for the same purpose, for denoting the presence of everything all. Okay, fine. So this is the first term. Now we will move to the next term. Next term is eu or normo. Eu is representing you and normo. They both are used for showcase the sense of good or normal. Okay, so let's see the example, because that's why I have noted down example, because usually what happens, we learn the term that this prefix is used, but without learning about the examples, it is we are not pretty much sure that whether how to use it or how to understand it. Okay, so that's why I have noted down a couple of examples, so that will help you to understand the things properly. So as I said that you and normo is used to make a sense of good and normal. So let's see the example. Eupenia, where normal breathing. So you can see normal is included. So normal breathing or the state of normal respiration. So whenever you are going to denote something as a normal respiration, in that case you will use eupnea. Clear? Then we have eupepsia, the state of normal or good digestion. Okay, so here again we are using eupepsia in order to showcase the with the prefix eu, which is showing the state of normal and good digestion. Okay, then we saw two examples for you. Now we will discuss about normo. So you can see normochromia, the condition where red blood cells contains a normal amount of hemoglobin. Okay, the condition where red blood cells contains a normal amount of hemoglobin. So whenever there is something where you want to make a sense of normality or good, then in that case you will use the prefix normo. Clear? Then we have normotensive. Normotensive means referring to a person with normal blood pressure. If you remember, in previous session we used the term hyper and hypo with this tensive, right? Hypertension, hypotension. So hyper was indicating the higher, above normal, yes, and hypo was representing the below normal. Then what is the state where we can show the normality? So in case of normality we will use this term normotensive. Okay, so this is all about u and normo. Now we will move to the next terminology prefix, which is a or n. This term or this prefix is mainly used to show the absence or negation. Okay, let's see the example. Febrile. Febrile means referring to the absence of fever. So whenever there is a patient for which there is no available, means when he is not suffering from a fever, then in that case we will use this term febrile, referring to a absence of fever. There is no fever, right? Similarly, we have one more term, anemia, a condition characterized by a decrease in the number of red blood cell, hemoglobin in the blood. Okay, so that's why we are using anemia. Okay, where it is showing the decreasement, or you can say absence. Okay, absence would be the perfect word here. Then we have anorexia. Anorexia means loss of appetite or lack of desire to eat. Anorexia, loss of appetite or lack of desire to eat. So whenever you see this anorexia in any of the medical report, you can easily identify that patient is suffering from loss of appetite and he has not any desire to eat the food. Okay, then this term, next term, is very commonly used term, anesthesia, the loss of sensation. So whenever we want to loss or we want to show or indicate the absence of sensation, especially pain, in that case we use the term anesthesia. So if you remember, this is the same medicine which is provided to a patient in case when they are going to be operated for a particular disease. So in that case we use the anesthesia medicine. Okay, so anesthesia means loss of sensation, especially to pain. Fine. Then we have next term as megalo. Megalo is also representing large or great. So whenever there is a sense to show something large or great, in that case we will use the terminology prefix as megalo. Make sure that we are learning about prefix, not the entire word, right? That's why I'm using only prefix, because prefix is indicating many things, as we saw that. Okay, so the first is megaloblastic, referring to a condition characterized by abnormally large red blood cell. So whenever you want to show something as large, there is one more prefix we learned already, right? That is also indicating the large, but this is another one, megalo, where we are representing the large or great. So in megaloblastic, we can say referring to a condition characterized by abnormally large red blood cells. Then we have megalocardiac, enlargement of the heart. So again, enlargement, greatness or large of the heart. Then we have megalomania, a psychological disorder characterized by delusion of grandeur, power, or wealth. So this is also comes under megalomania. Then we have megaloblast, immature red blood cell. Again, there is a sense of larger, so that's why we are using megalo. Okay, so yeah, these are the some prefixes that we use with medical terminology in order to denote some numbers or amount. I hope this topic is clear to all of you. I recommend you to keep a note of everything because we are going to discuss each and everything in detail. So I recommend you to please keep a note that will help you for your interview or for your certification preparation. Okay. So yeah, that's all for today. And this is the question for today. What is the difference between macro and micro? Please put answer for this question. It will also help you to recall the topics. And also if someone is not aware of this answer, he can simply look at the comment section so that he will find out the exact answer of it. So I request you to please share your knowledge, put your answers in comment section. Okay. So yeah, that's all for today. I hope it is clear to all of you. In the next session, we will discuss few more things. So thank you for watching Tech Sharmit.